The Affordable Health Care Act kicks in next year, and a lot of people still have questions about what it means for themselves and their families. Cairo Television is going to air a live town hall on Obamacare called Health Evolution, Thursday evening, 7 o'clock. Joining us in studio this morning is one of healthcare experts, the healthcare experts who will be featured on this program. She knows this stuff backwards and forwards. Megan Howell is the Director of Policy and Regulatory Affairs at Group Health. Welcome to the Bob Rivers Show.
Thank you for having me.
All right. We talked on the radio about this. One of the common misconceptions is if you don't have health insurance, you're going to jail. You're not going to jail.
No, you're not. And the IRS is not coming after you. What happens in 2014 is that everybody is required to have health care coverage.
And now, from what age, what's the youngest a person is going to be that they have to be responsible for
everybody, all different ages. So the parents will obviously be responsible for the children, but everybody in the United States, with very limited exceptions, is required to have health care.
So either your parents took care of it, or if you move out of the house, you got to take care of it.
That is right.
All right. And now, let's say I don't know anything about this, and I currently work part-time. Say I work at a place that hands people coffee through a window, and I only have 29 hours. Do I have to get my own health care out of my money?
Yes, you do. But there are a lot of options for coverage. In some cases, it might actually be free depending on your income level. So the best place to go, starting October 1st, which is the first day that you can enroll in healthcare coverage for the effective date of January 1st in 2014, is to go to www.wahealthplanfinder.org. And that will give you all the information about these health plans that are highly subsidized by the federal government and allow you to shop and compare.
Now, I did see in some of your materials that if you're not making that much bread, a lot of the times it's free or you only have to pay a smaller amount.
That is true.
And can you find out what income level you need to be at for this?
Sure. So we have two different programs that are going to happen on January 1st, 2014. First is the Medicaid expansion. So that's free coverage. Very, very rich benefits, free coverage for everybody, all adults, up to 138% of federal poverty level. So for a family of one, that's about $15,000. So that single person selling coffee through a window, $15,000 a year. However, for your family of four, it's $32,000 a year.
And if you're making that or less,
correct,
it's provided for you at no cost.
Correct.
Okay.
And that would be under Medicaid.
And this is the safety net that was talked about to making sure that all people are covered.
Exactly.
What else is new? Can my spa treatments and acupuncture, and what if I feel like I need to retreat at some sort of holistic chanting room or something? What's covered, what's not?
Unfortunately, I don't think the holistic chanting would be covered under the new Affordable Care Act.
It's a hole in the system, the holistic hole. In other words, are they going to tighten up on what's covered? Because I've heard that some things are going to be like more difficult to get.
Sure. So every health plan that's sold in the individual market and small group market in 2014 and beyond have to include what's called the 10 essential health benefits. And so that's to make an apples-to-apples comparison amongst the health plans and increase the quality of the health plans that are provided to the people of the United States. So some of those benefits would include what you would think of under health coverage, such as hospitalization. But what's unique is that now maternity has to be covered, which in the past has not been covered in the individual market in some plans. Also, prescription drug coverage must be included, which in the past may not have been included. So you get a richer benefit in 2014. So you know that whatever your health plan needs.
So a lot of stuff is good as better benefits, but some of the fringier things are cut off.
Of course. Okay. Yes, that's definitely true.
All right. And now, how will the people of Canada feel about this? Will they all want to move here, or will we want to move to Canada? You know, we've always talked about their free health care, but I've heard that it takes a long time to get an appointment when you're sick and things like that. How are we going to avoid some of those problems?
Well, first things to think about is that you have to be actually a legal resident in the United States in order to qualify for some of these assistance programs to purchase health coverage. So that's important to think about.
So if someone's visiting here and they get sick, sock it to them.
Oh, no, that's a different situation.
Okay.
But if you want a health plan coverage in 2014, you need to be a legal resident. Or
What is that going to do to the millions and millions of illegals in this country?
that is a big problem, and that's something that will have to be dealt with separately, unfortunately. So they're still in desperate need of coverage, and the exchange and the Medicaid expansion will not cover that population.
All right. What about people who are doing well? The people who have a great plan now, maybe people buy their own plan. Will there be any change for those people? Will it get, everybody says it's always getting more expensive. Will it get more expensive for the well-to-do, or is it going to stay about the same?
Well, actually, there's a second option of coverage in addition to Medicaid expansion. It's the exchange, and it's the Washington Healthcare Exchange, and that actually goes up to 400% of federal poverty levels. So for a family of four, that's $95,000 a year. So anybody that makes up to that amount can actually have assistance to help pay their premiums through the Washington Health Benefit Exchange. So you can see that it's far-reaching in the assistance that the federal government is providing.
And young, healthy people, it is sometimes said, who aren't necessarily going to follow through with this, even though they're supposed to be in it, are going to be the plan's downfall, because they're the ones that are really needed, because they're not going to really get sick, likely, but they're the ones that money is needed to make this all work and balance out financially. Is there some way to make sure all of the young, healthy people actually participate, and is there a concern that they won't?
There is still a concern. There is the what's called the individual mandate. That's the requirement to purchase coverage. And if someone does not purchase coverage, then at the end of the tax year in 2014, they will either have to pay a $95 penalty or 1% of their income over the filing threshold, which is $10,000. So that's a little bit of a penalty, and there is some concern that that's not strong enough in the first year to get those young and invincibles, is what we like to call them, to sign up. But I will say that even though you're young and invincible, you never know. I've had family friends who have been diagnosed with cancer at the age of 25. Very healthy
Can happen.
people.
Yeah.
Yeah.
All right. You want to be covered. Megan, thank you very much.
Yeah.
You work for Group Health.
I sure do.
How's their plan?
Their plan is actually
I could bet it's probably pretty good.
I'm actually on their plan, and I can say it's pretty robust, and I actually do. To give a little props to Group Health, I do really like their system in the sense that as a mom of a 2-year-old, I can go up to their clinic and take care of everything. I can get the lab work done. I can talk to my doctor over the internet. I can get my prescription filled right after my appointment. It's a pretty cool system, and it allows you to really get close to your doctor.
See Megan and other experts on Town Hall. It's the Town Hall on Obamacare. It's called Health Evolution, Thursday evening at 7 o'clock on KIRO Television.